Welcome back. You're at the Morning News. A radical new brain operation is being used to treat patients with severe depression. The procedure has so far treated 5 Australian patients and is achieving promising and unexpected success. And joining us now from Melbourne is Neurosurgeon Associate Professor Richard Bittar. Good morning, Professor. Thanks so much for your time this morning.
Thank you.
Now, this procedure, I understand, is called Deep Brain Stimulation. Tell us exactly how it works and how successful has it been on these 5 patients?
Well, this is certainly a new and exciting treatment for some patients with depression. We've been doing it for a while for Parkinson's disease, and what we do is we implant very fine electrodes into specific parts of the brain to try and rebalance the flow of electrical activity through those areas and try to make the patients feel better.
How successful has it been on those 5 patients?
Well, we've done 5 patients over the past few years, and certainly the first 3 patients have done quite well. The results for the remaining 2 patients are very, very encouraging, but we need to wait and see how they go over the next year or 2. But certainly the signs are very, very positive at this stage.
Now, I understand that this is just specifically for some types of depression and for those people that suffer severe depression. Does this mean after this treatment that they don't need medication?
We use deep brain stimulation. We reserve it as an option for patients who have tried all of medications, who have tried electroconvulsive therapy and who have essentially failed all of the usual treatments. Those patients whose lives have become intolerable, who might be considering suicide and who are really quite incapacitated by their depression. In those situations, we would certainly consider offering them deep brain stimulation.
Now, I understand this procedure is banned in New South Wales for this specific treatment of depression, but it's okay to use it in Victoria. Why is that?
Well, that's a really good question. That's a question that we're asking the politicians of New South Wales and that a lot of our patients are asking. I think a lot of it's a throwback to the deep sleep scandal a couple of decades ago in New South Wales, and I think essentially the law in New South Wales has just failed to keep pace with changes in medicine, changes in technology and changes in what society demands.
And just with this actual procedure, Associate Professor, I understand that you do stimulate the brain during the operation. They are awake during this procedure, and I even heard one patient could see dramatic effects whilst undergoing the procedure. Is that correct?
Yeah, it's fascinating. We do the operation with the patients awake, and that was one of the things that we didn't appreciate when we started out, that we would be able to elicit a very palpable change in their mood and in their levels of interest on the operating table. And we were able to modify their mood and their speech by just making very fine adjustments in very specific areas of the brain, and that's very helpful to us in trying to put those electrodes in the right spot.
Considering its a promising success so far, could you see that this may be a way forward for other forms of depression, just not severe forms?
Look, I think we have to be very, very careful because it still is, it's brain surgery and it does carry risks, and there is that small risk of having a stroke with the surgery, so it's probably not something that will be necessary for people with more mild types of depression, something that would be offered to those people. But it's a lower risk type of surgery than what was done many years ago, and I think that as we see the results, more long-term results, I think that this procedure will become more applicable to a much greater number of patients, and maybe some of those patients who aren't quite at the most severe end of the spectrum but are getting there.
All right, well, good luck with your work and thanks so much for joining us this morning.
Thank you, Natasha.